Hello, I'm Dr. Harsha Sarawgi Gupta. I'm a dermatologist by profession, and other than dermatology, I specialize in treatments like laser and other aesthetic procedures. So even chemical peels, hydrofacials, medifacials, and all types of EDRF procedures. So I believe that doing PRP and hair treatments is something that is my core source of interest. Today I'll be talking about hyperpigmentation. So hyperpigmentation is a condition, as the word says. There's hyper, which means more, and pigmentation, that is increase in the color of the skin. So hyperpigmentation basically means increased color of the skin in different areas. It could be your face, it could be the rest of your body, or any other part of the skin. So when we talk about pigmentation, it could be of basically two main categories. It could be hyperpigmentation, which is increased skin pigmentation, and second is hypopigmentation, that is decreased skin pigmentation. These are the mainly two broad categories that we have. So talking about hyperpigmentation, it can be because of varied reasons. It could be as simple as having a UV exposure, that is excessive sun exposure. It could be secondary to any acne. For example, a post-inflammatory hyperpigmentation. After your acne gets treated, sometimes see these dark spots which stay back. So that is a post-inflammatory hyperpigmentation. It could be something which could be much more difficult to treat, like melasma, which is a mask of pigmentation which is present mainly over the cheek area. Especially in patients post-pregnancy have this, called as chloasma. Hyperpigmentation could also be because of certain frictional causes like frictional hypermelanosis, especially over the areas of your temples, which you commonly see. It could be because of insulin resistance like diabetes mellitus, which could cause acanthosis nigricans, which is a velvety patch over your neck area and even your temples, your forehead areas. It could also be because of using certain cosmetic products and perfumes, which is called pigmentation due to the exposure to these fragrance containing products. Other than this, there are multiple causes like lichen planus pigmentosus, Addison's disease, and a lot more. There's a huge varied list that follows, but these are the most common causes for it. So talking about treatment for hyperpigmentation, we have different approaches for different kind of patients and the different causes of hyperpigmentation. It could be as minimal like a topical based treatment in the form of creams and lotions that is prescribed, and it could also range to more advanced treatment procedures like chemical peels and lasers. Now, depending on the kind of your pigmentation, your doctor can suggest you what is best for your kind of pigmentation. It could be a combination of these multiple treatments together, or it could just be a single procedure. Talking about the pigmentation peels and all which can be used, so it could be something like a glycolic or an RG peel. Sometimes for your under eye pigmentation, the doctor can give you serums. So there's a lot which can be done. I'd suggest you to visit your dermatologist and then decide upon the exact treatment plan for the pigmentation that you have. So in case you have any more queries about hyperpigmentation or you want to get treated for it, you can consult me. I'm Dr. Harsha Sarawgi, a dermatologist, and I'll be available here for you. Thank you.